Hi all, my name is Emil Joseph. I'm an associate professor with the School of Social Work at McMaster University.
I'm Shayla Kumbare, and I'm a PhD student at McMaster University.
We briefly want to talk about the work that we've been doing with the project we registered through the World Pandemic Research Network, which we've now called A Way Through, which is a online resource for grief, memorials, and loss through COVID-19, specifically a compilation of resources for caring for others and yourself while physical distancing. So the COVID-19 pandemic posed unique challenges regarding the ability for people to respond to loss, grief, providing care, and being supportive, sympathetic, and empathetic to others, especially given the demands of isolation and physical distancing. In response to these needs, our research team partnered with the Canadian Mental Health Association of Hamilton to develop online resources designed to support people coping with the infection and those dealing with loss and grief, to share alternatives to social gatherings for memorials after the loss of a family member, colleague, or friend. The resources that emerged from this project also attended to issues of equity and inequity and accessibility by incorporating contributions and suggestions of those in the community, who service providers and cultural and religious and spiritual leaders. And the resources are now available in accessible formats. And there's some resources that are available in a few languages. And this resource is now public and can be shared by health professionals and social service providers, public institutions, the private sector, and the general public.
So through the pandemic, we've had to kind of change the way that we look at grief. In the case of rapid and intense social change, people often feel an exacerbated sense of loss. And when grief can't be publicly acknowledged or socially supported the way we traditionally do, it's impeded by social circumstances, it can produce disenfranchised grief, which then magnifies anxieties and regrets, worsens negative thinking about problematic behaviors. Problematic behaviors. This in turn can result in increased service needs and pressure on already stretched healthcare systems. The resources and development through this research will engage with existing knowledge on trauma, grief, bereavement, and loss. Grief, loss, trauma, and bereavement require a deeply engaged attention to issues of equity, diversity, and inclusion, and the need for cultural sensitivity when considering alternatives to rituals and traditions. So we've had some changes in our grieving practices through the pandemic and social distancing. Pre-COVID, traditional methods of grieving for Canadians were funeral, wakes, and memorials, individual and group therapy, death rituals, and religious ceremonies. But during COVID, funeral services have been closed and limiting participants. There's been no ability to physically comfort each other or gather. There's been an inability to perform grief rituals and religious ceremonies, and we've been unable to visit dying loved ones or carry out final wishes. So the value of online support. Rituals are only as important as the meaning you draw from them, which means that they can be just as meaningful if performed online. In the context of COVID-19, findings suggest that restrictions to funeral practices do not necessarily entail poor outcomes or experiences for the bereaved. It's not the number of attendees or even the type of funeral that determines how supportive it is, but how meaningful the occasion is and how connected it helps mourners feel. So to address these challenges effectively, citizens will need more than resilience, will need political imagination, creativity, and courage. So A Way Through, some of the benefits of A Way Through are that it reduces barriers to support by being convenient, free, accessible, and less time consuming or stressful to access. It takes strain off community agencies. It supports people in seeking support from the sources they like. It presents diverse understandings of grief, encourages community connection, attends to issues of equity, and values creative expression.
And there's a link there to the website A Way Through on the bottom of this slide. And if you have a chance, you can explore it. And the entry points really allow for you to access resources if you're looking for them to support yourself, if you're looking for those to help you support others. There's some specific sections around memorials and thinking about memorials online in respectful ways, as well as ways to access online support and to send in your own content. Thank you.